So we're going to start off with a pulse this afternoon. So as always, we have to get our patient's consent. So Brody, is it okay if I take your pulse?
Sure.
Cool. So what we're doing is we're locating the radial pulse, which is just under the patient's thumb on the outside, and you're going to measure this using your 2 fingers. Once located, you're going to count for 10 seconds. Cool. So Brody has a pulse of 64, and so that is within the healthy range. So now we're going to do a blood pressure test. Once again, quite an invasive procedure, so we're going to ask for the patient's consent. So Brody, do you mind if I take your blood pressure?
Not at all.
So for this we need a blood pressure cuff and your stethoscope. So it's important to have the right size cuff, or else it'll be too big or too small for the patient. So this is the range here, and it needs to roughly be the same size as the bicep. So you're then going to locate the artery sign, put that on top of his brachial pulse, wrap this around nice and tightly. So after that's on securely, you're then going to get your stethoscope and you're going to locate the brachial pulse. And you're going to be pumping this up until you can't hear the pulse anymore. Once the pulse is stopped, give it one more big squeeze and let the air out slowly. So Brody's blood pressure today was 125 over 80, which is in the perfect healthy range. So Justin, do you mind if I take your lung sounds today?
Sweet, all good?
Cool. So what you're doing is the curve end facing away, and you're doing all 4 corners of each point of the lungs, anteriorly and posteriorly. Right, so I'm just going to listen to your lung sounds. Can you breathe in through your nose and out your mouth? Cool. One more, please. Sweet. So usually, as I said before, you do 4 and 4, but for the purpose of the demonstration, just going to do the 2. What you're listening for is any irregularities, such as rails, crackles, wheezes, or anything like that. What we're also going to do is we're going to measure his respiratory rate, so how many times he breathes in per minute. So what we're going to do is we're just looking for the rise and fall of the chest over 10 seconds. Cool, so in that time I counted 2, so you times 2 by 6, that's a respiratory rate of 12, which is in the perfectly normal range for a healthy adult. So thank you for that. So I'm just going to demonstrate how to use an OPA. An OPA stands for oral pharyngeal airway. It's used to secure and maintain an airway or assist with other breathing apparatus. So you need to figure out if the patient is eligible for one, and a good indication is whether the patient has a GCS of less than 8 or less than 2 verbally. So as you can see down here, there's a range of sizes. They will change for each patient. Obviously, children, pediatrics will have smaller ones than adults. I've pre-measured this one. How you do it is from the side of the mouth to the corner of the mandible. So this should be the correct size for this patient. So how to insert it is first you're using your C grip to open the airway, putting his head backwards. And the curve of the OPA is going in, facing upwards towards the roof of the mouth. You get it in, and when you feel it's about halfway, you rotate it 180 degrees, and then slide it to the back, just like that. I'm just going to demonstrate how to do the NPA, which means the nasal pharyngeal airway. Indications for a patient that will accept an NPA is if they don't accept the OPA, if they've had trauma to the mouth, or if they're vomiting, etc., or if their teeth are tightly clenched. Although the NPA doesn't definitively manage an airway, it's still quite an effective means. Benefits include it doesn't induce a gag reflex, and the patient can have a high GCS. And also if the patient has tismus or jaw spasms, it's a very good approach. So To measure the correct size, we get one of these, pop it on the nose and down to the side of the mandible, and afterwards grab some lube that should be in your first response kit, lube it up and place it accordingly. Now, it's important to insert it very slowly and feel for any resistance, and just give it a little wiggle on the way down. If there's too much resistance, you want to swap nostrils, but your first nostril should always be the one that is larger. So I'm going to show you guys how to use the LSU, which is the lateral suction unit. This is used when a patient has unwanted fluid matter in his mouth or throat, such as blood, mucus, or vomit. So it's important to check that the actual machine's functioning properly first. So what we do is we put it on to max, put a kink in it, and check that it goes up to 350. So that's sweet. What we're going to do is first put the patient in the lateral position. Right, so we're going to put it on now to 350, and it's important to insert it only as far as you can see down the oropharynx. You're only suctioning on the way out, and you do this by placing your thumb over the hole in the catheter. And what you're doing is circular motions and tipping the matter out onto the ground. So to turn it on, top left, press the on button. It's going to make an annoying noise, so to put it onto manual mode,
push analyze.
Yep, I'm going to go to energy select, and just scrolling left, putting it onto manual mode. I'm going to also change it down to 50 joules, just because we're going to be running a test later. So the first thing to check when you're doing a check of the machine is the battery level. So the first one's a bit low. If we were to change it, you just need to rotate this forward, open the yellow pouch at the back, and you can change the batteries just as is. But they're fine for our test today. After this, we're going to run a operation check, so that makes sure that everything's going fine on the inside. So to do that, we just press options and scroll down to a user test. While that's happening, it's a good opportunity to check all the pouches to make sure we've got everything. So this one should have the defib pads, which should be, yep, 2017 is the use by date, so we've got a while on that. There's also paracetamol and a razor in there for those hairy patients. On this side, you've got your ETCO2 and your SpO2, which I'll go over later. And in the back, you've also got your blood pressure cuffs, one for an adult size and one for a pediatric size. So once we've checked all that, we can check, and it says user test passed, which means it's ready to go. After that, we're going to turn it on to AED. So we just press charge. Sorry, that's the wrong one.
Connect electrodes.
After that, we're going to do a test shot. We're going to go into energy select and pop it back down to 50 once again. And then we're going to press charge. So I'm going to plug in my test load here, and that's just going to put a shock through it instead of actually doing it on myself. So press charge. When it loads, you press the red button to administrate a charge. If you want to cancel a charge, once it's at the red button, you just press this. Press it in and it'll cancel it. So now we're going to go on the ECG. So I'm going to plug this in to the other side, which I've already set up, and turn that on, and you should be able to see the heart rate there. So if we wanted to change the volume, so we hear the beeps, you just scroll into the top left, press the middle button, press it again, and then you can change the volume. Also, if you want to change the size of the QRS, you just select it using the same knob again, scroll down, and you can change the size bigger or smaller. So we'll just pop it back on one. If you wanted to test the patient's blood pressure, all you need to do is press this button here, NIBP, which means non-invasive blood pressure, using one of the cuffs in the back. It's a very accurate form of measuring blood pressure and saves you setting it all up manually. This device here is to measure the end tidal carbon dioxide output from the patient, and your oxygen saturation leads are all in this one too. Right, and if you wanted to change the lead side, all you have to do is press this button here, and you can choose one of 6 options there. So you just scroll down and hit the middle button once again to choose the appropriate lead too. Finally, to change a roll, you just open this flap at the front, make sure that there's enough paper in there ready for the next team to take over. And that is the basics of our life pack. When administering oxygen, first we need to check that the cylinder we're using is actually oxygen. So it will be labelled on the cylinder, it'll generally be white and they'll have the 2 prongs. We also need to check that it says in use and not empty. So before we put our regulator on, we need to check the Bodac seal is nice and tight. We're going to line these up with the prongs down here, putting them in like so, and just winding them up quarter turns at a time, waiting until we get about a finger's strength of tightness. We don't want to over tighten it. Afterwards we can turn it on, and we just check the front to make sure that there's enough oxygen in the cylinder. We're also going to check that it flows nicely on all the different strengths. So to put an actual mask on our patient, we're going to insert the tubing down below like so. We're then going to put on the litres per minute first, and so for this type of mask it's 6 to 8. So once the air's flowing, you can then put it on your patient's face. So do you mind if I put this on you? Okay. So we're just putting it nice and carefully over the patient, being very careful about the ears, popping it on like so. So once that's on there, once you've done everything you need to do, you can take it off again. So after we've taken the mask off, what we need to do is flush the regulator to get rid of any excess air. So we're going to be turning this off and then putting it on the max just to get rid of anything. After that's done, twist it off nicely and take the regulator off. I'll also add in that if we're doing this in a real life scenario, we would be laying the cylinder on the ground to ensure the safety of everyone around us. Now we're going to demonstrate the use of a C-collar. So practically what they do is they immobilise the patient's neck from preventing further injury. To see if a patient is eligible for the use of a C-collar, we need to apply the Nexus rule. So as always, we're going to gain consent. So Brody, do you mind if I put a C-collar on?
That's fine.
We're just going to put this on today because we think you've got some neck injury. It's just going to keep it in place on the way to the hospital and prevent any further injury. Do you understand?
Okay.
Okay. So after you've got the consent, what we need to do is measure using our fingers from the patient's shoulder to the bottom of the mandible. So Brody, I'm just going to measure right now. So that's 4 fingers. We're popping that down there and then adjusting it to the appropriate setting. So it's already been put on the proper setting, so we don't need to change anything. If you did need to change it, you would push these buttons in and you can slide the collar up or down. Right, so as you can see, I've already got Zoe helping me out. Just grab any offside will do, just to hold the head while you're putting this on. You can do this by yourself, but it's not recommended and makes it much more difficult. Alright Brody, we're just going to pop this on now.
Okay.
It's going to be a bit tight, it's going to be a bit uncomfortable, but it's definitely for the best, alright?
Okay.
So this part just goes under the chin here. And we're just going to wrap this around the back. Just getting it nice and tight until the Velcro clips in place. So now we're going to do some hemorrhage control. So the first thing that we need to do is expose the area that we need to dress. So we ask the patient a series of questions to figure that out. Zoe, hello.
Hi.
How are you?
Oh, I'm okay.
Yeah, bit sore?
Yeah.
So I understand you fell over?
Yeah, my leg's sore. I think
Yeah?
I cut it.
So this one here?
Yeah.
Have you had a look at it yet, or you've
No,
just left this down?
I'm a bit squeamish.
Mind if I roll your
That's right.
hand sleeve up and then start to dress the wound?
Mhm.
Okay. Oh, you do too. Right. So the first thing we need to do is clean. Just keep looking away. Don't worry about it. Obviously, if it's a very bad cut, we'll offer some pain relief, but this is just superficial, so it'll be okay. First thing we're going to do is use some saline, which will be in your first response kit to clean the wound. We use one of these dressings, which is a compound dressing, just to do that. So just put a little bit on there, and just gently dab it carefully, just to remove any unwanted matter like little bits of rock, gravel, sand, or glass, very common. So once that's clean, you get the dressing, fold it into squares, as smallest as you possibly can, to cover the wound, and just place it on there. Right, so I'm just going to wrap it up in this, and it's going to take a bit of the pressure off, and then we'll figure out afterwards what you need to do. Probably get it checked out at hospital, just to check the infections and make sure everything's okay. So we get a crepe bandage, and we're just going to go around and round, covering all of the corners and all the surface areas. Make sure that no air or anything can get out. So once that's nicely covered, we can start twisting over the top, just to get it nice and tight around the actual wound. So just keep going round and round, twist it a couple of times to get the pressure. How you feeling, Zoe?
Okay.
Yeah, better now. I'm now going to demonstrate how to apply a tourniquet to a patient, which is used for catastrophic hemorrhages. So what we need to do is expose the area. So we're just going to roll his sleeve up here. And today, for training purposes, we're saying that the deep laceration is under his elbow. So the tourniquet should be found in the trauma kit, trauma side of the response pack. And it's just going to be inserted 10 centimeters above the wound onto the patient's arm. So you're going to wrap this around very tightly. And what this is doing is it's stopping the blood coming out. So after the Velcro is around, you're going to twist this as tight as it can go, and then pop that under there. After you've completed the tourniquet, you record the date and time on this slip here, and you feel for the distal pulse from the laceration, or you look for blood loss. If there's still blood loss and there's still a pulse, you can then immediately administer another tourniquet proximal. These should be found in your first response kit, and looks like this. So there's a few pieces that require setting up. So the valve needs to connect to the correct mask. So check that with the patient first. Need to make sure everything's nice and tight, or else the air can escape while we're trying to ventilate our patient. So since we're using oxygen today, we should get a nice amount of ventilation. If we were unable to access oxygen, we could still use this reservoir, but just take the oxygen bag off the back and do it with our hands. So we're going to connect this tubing up, and since it needs 10 to 15 litres per minute of oxygen, I'm just going to put on about 12. So once it starts filling, you can hear and see that this is all filling correctly. Just double check that there's no breaks so the air's coming out. While that's filling up, we're going to get our OPA just to maintain the airway. Once again, putting it from the corner of the mouth to the mandible, inserting it with the curve facing the roof of the mouth, inserting it halfway, rotating it, popping it down. So now that the bag's ventilated, we can use our C grip, placing the mask fully over the mouth and the nose of the patient, and tilting the head up. So we're looking for chest rises, and we're doing one ventilation every 5 to 8 seconds. So now we're going to talk about some fracture management. So the first thing to do is ask the patient a series of questions just to figure out the severity of the injury, how we're going to go about it, and where we think the injury is. Hey Zoe, how you going?
Oh, a bit sore.
Bit sore?
Yeah.
So you've taken a nasty fall on your arm, is that right?
Yeah, I slipped over cleaning the kitchen.
Yeah. Whereabouts is the pain coming
Just
from?
along here, it's so sore.
Okay, that's cool. So do you mind if I just go through a few procedures to figure out where the fracture might be today?
Yeah.
So are you able to wiggle your fingers at all down there?
Yeah, it's quite sore, but I can...
And what we're going to do is we're just going to test the capillary refill, also the temperature, and you're always comparing this to the other limb. So on a scale of 1 to 10, 0 to 10, how much do you think your pain would be?
Probably a 7.
A 7, yeah. And so when you're holding it like that, I can tell it's a bit painful, but do you still think you can bend it a little bit up and down?
Yeah.
Yeah, cool. So there's no unusual movement here, which is good. No deformity, which is good. It is a bit swollen. So just looking at the other one, it is a very swollen arm, so I do think it's going to be a fracture. There's no shortening, so we don't have to do any alterations on the arm today. And I'm just going to, do you mind if I just feel top to bottom just to find out where the pain is? So just tell me whereabouts it hurts.
Ow, ow.
Yeah, there?
Yeah.
Okay, so it's going to be that we're going to do a box splint on the lower arm, and while you're doing this, you're also listening for crepitus, which is the creepy noise of the bones. So before applying a splint, we're going to want to do some pain relief. So it's important to figure out, obviously, the dosage size, any contraindications, and apply that before we start the splinting. So Zoe's able to obey commands, which is good. Do you have known renal impairment?
No.
No. Have you had methoxyflurane in the last week?
Nope.
And does yourself or anyone in your family have a history of malignant hypothermia?
I don't think so.
No? Cool. Okay, so she's eligible for that. Now, some patients, they feel a bit drowsy, a little bit lightheaded, and they may get a bit of nausea. Is that okay with you?
Mhm.
It's going to bring your pain right down, so, yeah? Okay. So, I've made this up before. We've got a mask on the end, just to keep the fumes inside. This is a charcoal filter, and the drugs go in the top there. They come in here, and when you're doing this, obviously you check the date, and for adults they can have up to 6 mils in 2-3 mil doses. So we're going to start off with a 3 mil dose and assess the pain score later to see whether she needs some more. So after the pain relief has been given to the patient, we're able to start the splinting. So I've just grabbed the offsider here to help me keep the arm stable while I'm applying the splint. Okay, Zoe, we're just going to start applying the splint now. Is that okay with you?
Yep.
Okay, if you could just hold her arm still, just avoiding this area here. So I'm going to grab a piece of cardboard that's in the first responders kit, some of this, and a bit of towel for cushioning. How's that methoxyflurane going? Are you feeling a bit better?
Pretty good.
Yeah?
Yeah.
Cool. Okay, so I'm just going to slide this under here. If you're able to just... Very much. How's that? Not too painful?
It's okay.
Okay. And Brody, you could just hold that there.
Yep.
Thank you. Doesn't feel too tight or anything?
No.
No. Just got to be really careful when you're going over the affected area. You still wiggle your fingers down there? That's good. Okay, so now we're just going to pop it in a sling as well. So we're just putting the corner on the edge. Just like that. Just going to wrap this around the neck here. So we're just making a saddle to hold it in place, twisting this around, and then tucking that in there. So how does that feel?
Yep.
Yeah?
Pretty good.
So not too tight?
No.
You still wiggle your fingers. So we're just going to check the capillary refill again. Temperature's fine. And so after the methoxy, what do you think your pain score would be now?
Oh, probably about 2 or 3.
2 or 3? Okay, so as you can see, it's worked fine and there's no need to administer another dose. Okay, so we've arrived at the scene of what we think is a cardiac arrest. First thing we need to do is check the area for any dangers. This includes live wires, water, people around creating hazards. Area looks fine, so we can start. Hello, hello, can you hear me? Sir, can you hear me? Okay, no response. Brody, could you please request backup?
Sure. AUT1, request now 50.9.
So what we're going to do now is we're going to check that there's no obstructions in the airway. So we're checking that there's no vomit or the tongue hasn't rolled back into the back of the throat. We're also going to be listening, feeling, and looking for chest rise for 10 seconds. Okay, no response. Brody, could you please start CPR?
Sure.
So it's important to start the CPR as soon as you can. It just increases the chance of survival for the patient. So Brody, I'm just going to pop the AED on around you.
Sure.
But just definitely keep those going. And what you need to be doing is a third of the chest in. We're looking for recoil, and Brody wants to be doing them at 100 beats per minute. 30 for 2. Okay, I'm just turning this on.
Analyzing heart rhythm.
Okay, just
Do
stop
not
CPR.
touch the patient. Shock advised.
Okay, stay clear.
Charging. Stay clear of patient. Deliver shock. Now shock delivered.
Okay, when it says just start again,
Yep.
please.
Start CPR.
Okay, so now what I want to do is manage the airway, so we're going to start with the OPA, measure that as we do, pop that in, and now we're going to set up the BVM. So I'm going to put it on the max straight away, just because he's not breathing. So we're lying this down, and I'm just going to use my C grip to administer the BVM. Okay, Brody, I'm just going to ventilate now, so
Yep.
can you watch for chest rise and tell me?
Chest rise. Chest rise.
Okay, keep going, please. So we're going to keep going at 30 for 2, and we're going to swap around at the next shot,
Cool.
just because CPR can get very tiring, so you generally want to swap between people every 2 minutes.
7, 28, 29, 30. Chest rise. Chest rise.
The compressions are going well, man. Keep it up. Do you mind if we do a cryo check pressure after
Yep.
this one? So this just opens the airway, pushes down the esophagus, makes sure that no contents from the stomach come back up.
7, 28, 29, 30. Chest rise. Chest rise.
Beautiful. So I've also got a suction unit down here, just in case the patient regurgitates. We can then roll the patient on the side and use the suction to get the matter out of his mouth. But right now, the patient seems to be doing fine.
7, 28, 29, 30. Chest rise. Chest rise.
Keep going, man, doing some good compressions. It's also important to ask around when you get to the scene for a history of the patient, so if anyone knows the
7,
patient,
28, 29, 30. Chest rise. Chest rise.
if they know the patient or if they saw what happened, just to help determine the mechanism of the arrest.
Stop CPR.
Okay, we're just going to swap around now, Brady.
Analyzing heart rhythm. Stay clear of
Right,
the
stay clear, no one touch.
Analyzing heart rhythm. No shock advised. Pause. If needed, start CPR.
25, 26, 27, 28, 29, 30. Chest rise, chest rise. Twenty-five, 26, 27, 28, 29, 30. Alright, so after our resuscitation attempt, if the patient enters ROSC, we're going to keep the ventilations going. We're going to put him laterally, and if he does gain more consciousness, we're going to sit him up to help the breathing go. But we all need to be vigilant and aware in case he enters cardiac arrest again. Oh, you filming? Okay. Alright, we're just gonna need some gloves, jokes. Hi, today we're gonna be going over the Life Pack 15. Fuck that up, I'm gonna start it again. To flush it out, you're then gonna put it on full strength. Without any other underlying issues, so we're if a customer I think I have
It looks like you're carrying a man bag.
got this from Genshin. We're gonna put this on because we're inside. So that just goes in there. Fuck, does it? Hi, welcome. Today we're gonna be doing the Life Pack 15. There are various What?
Dude, someone's choking in the cafe!
I'm doing my someone's choking!
Choking!
Oh my god. Okay, quick.
Why are you filming, bro?
Snapchat! Snapchat!